Margaret had been taking her water pill for almost 3 years. Every morning, same routine, same medication, same hope that the swelling in her ankles would stay manageable. It had not. If anything, the puffiness that started at her ankles was slowly creeping up toward her knees. And every appointment ended the same way, same pill, slightly higher dose, same instruction to keep her legs elevated. Nobody was asking why the medication was not working the way it should. Nobody had asked what else might be happening inside a body that was swelling despite the medication specifically designed to stop it. When Margaret arrived in my department, she was not in crisis. She was exhausted in a quiet, long-term way, with ankles so swollen that her shoes had become decorative. Her heart was under strain, her fluid balance was off, and her thiamine level, a simple blood test, almost nobody orders in this context, came back low enough that it changed the entire conversation about her treatment. The water pill she had been taking every morning for 3 years was doing two things simultaneously. It was pulling fluid out of her body, and it was pulling thiamine out of her body at the same time, because thiamine is a water-soluble vitamin that exits the body through the same pathway that diuretics force fluid to follow. A medication prescribed to reduce swelling was depleting the very vitamin her heart needed to maintain the pump function that would keep fluid from accumulating in the first place. My name is Dr. Miles. I have spent the last 13 years working emergency medicine. Swollen legs and ankles walk through my department in many forms, some of them urgent, some of them nutritional, and some of them caught in a loop that nobody connected until it arrived in front of me. I built this channel because I am the doctor who sees what happens when those loops run long enough, and I would rather hand you the conversation before that point than after it. If you or someone you know is dealing with persistent leg swelling that is not fully responding to treatment, subscribe right now, because what comes next is the part of this conversation that almost never happens in the room where the water pill gets prescribed. Before I tell you which vitamin matters most, I need to give you something more important than a supplement recommendation. Swollen legs and ankles are not one condition. They are a symptom with a list of possible causes. And some of those causes need a doctor before they need a vitamin. Heart failure, kidney disease, a blood clot in the leg, and liver disease can all produce leg swelling, and none of them should be managed with a vitamin while the underlying condition goes unaddressed. If your swelling is new, rapidly worsening, accompanied by shortness of breath, chest pain, or one leg is significantly more swollen than the other and warm to the touch, those are not sufficient situations. Those are same-day medical evaluations. Everything I am about to tell you applies to the person already working with their doctor on persistent swelling that is not fully resolving, not to someone who has not yet had that conversation. With that said, here is the vitamin almost nobody is talking about in this context and why it is the one that matters most. Number 1, vitamin B1, thiamine, is essential for the heart to generate energy efficiently. Every beat of your heart requires ATP, the body's energy currency, and thiamine is a critical cofactor in the biochemical pathway that produces it. When thiamine levels are low, the heart's energy production becomes inefficient, and the muscle itself can begin to dilate and weaken in ways that reduce its ability to push blood forward effectively. Think of it like a pump running on the wrong fuel. The mechanism is intact, the parts are all present, but the energy conversion is happening at a fraction of the efficiency it needs, and the output suffers for it. The heart compensates by retaining more fluid, increasing blood volume to maintain output, and that retained fluid has to go somewhere. In a body where venous pressure is already elevated, or lymphatic drainage is already compromised, it goes to the lower legs and ankles first. This is not a rare or exotic mechanism. It is the clinical basis of a condition called wet beriberi, thiamine deficiency with cardiac involvement, and in its subclinical form, where levels are low, but not dramatically, so it produces a pattern of fluid retention and reduced cardiac efficiency that can look indistinguishable from early heart failure on a routine examination. Here's the part that makes this clinically urgent rather than just nutritionally interesting. Thiamine deficiency is present in an estimated 20 to 30% of older adults, making it one of the most common and most consistently overlooked nutritional deficiencies in the senior population. The reasons are multiple: reduced dietary intake, impaired absorption from an aging gastrointestinal tract, chronic alcohol use even at modest levels, and critically, the use of loop diuretics like furosemide, which are among the most commonly prescribed medications for fluid retention and heart failure in seniors. These diuretics work by forcing the kidneys to excrete more fluid. Because thiamine is water-soluble, it exits alongside that fluid. The medication treating the swelling can worsen the deficiency that is contributing to the swelling. That is the loop Margaret was caught in, and it is not rare. Tell me in the comments whether you or someone you know takes a water pill for leg swelling, and whether anyone has ever measured your thiamine levels, because the answer in these comments is almost always the same, and it tells me how wide this gap actually is. This channel exists because I am the doctor who sees where these gaps end up, and handing you this conversation now, before it becomes urgent, is the entire reason I built it. Subscribe if that is the kind of information you have been looking for. Addressing the thiamine question is a conversation to have with your doctor, a simple blood test, a discussion about dietary sources or supplementation if levels come back low, and a review of whether your current medications are creating additional depletion. The dietary sources most consistently associated with adequate thiamine intake in older adults are whole grains and legumes, the kind of foods that tend to disappear from a diet when appetite decreases or cooking becomes harder. Supplementation is widely available and inexpensive, and at therapeutic doses, thiamine has an excellent safety profile. The context matters though, which is why the conversation starts with a blood test rather than a bottle off a pharmacy shelf. The second vitamin worth understanding in the context of leg swelling is vitamin C, and its mechanism is different enough to be worth explaining separately. Your capillaries, the smallest blood vessels in your body, have walls made partly of collagen, and collagen synthesis requires vitamin C as an essential cofactor. When vitamin C levels are low, capillary walls become structurally weaker, more permeable, and less able to keep fluid inside the vessel where it belongs. Fluid leaks into the surrounding tissue. The ankles and lower legs, where capillary pressure is highest due to gravity, are the first place that fluid accumulates. Subclinical vitamin C deficiency, not full scurvy, just levels low enough to compromise collagen synthesis, is more common in older adults than most clinicians routinely test for, particularly in those with restricted diets, limited fresh produce intake, or significant stress on the body from chronic illness. Eleanor was 72, had been managing mild ankle swelling for almost 2 years, and ate what she described as a fairly good diet, mainly cooked vegetables, tinned fruit, and the occasional fresh piece. What her diet had quietly lost was most of its vitamin C, since the vitamin is heat sensitive and substantially reduced by cooking and canning. Her ankles were not dramatically swollen. They were persistently, mildly puffy in a way that nothing had fully addressed. Her vitamin C level came back borderline. She increased her fresh fruit and raw vegetable intake and added a modest daily supplement. 6 weeks later, the puffiness she had been managing for 2 years had reduced noticeably enough that she mentioned it at her next appointment without being asked. Eleanor's story is not a dramatic reversal. It is the kind of quiet improvement that happens when a deficiency that has been present for a long time is finally identified and addressed. That is the register most nutritional interventions work in, not overnight transformation, but consistent, measurable change in a body that now has what it was missing. One more nutrient worth mentioning briefly before the practical framework, because it comes up consistently in the clinical literature on fluid retention, and because it is depleted by the same diuretics that deplete thiamine. Magnesium is not a vitamin, it is a mineral, but it plays a direct role in regulating the sodium-potassium pumps that control fluid movement across cell membranes. Low magnesium levels impair those pumps, which can contribute to fluid accumulation in the tissues. Like thiamine and vitamin C, low magnesium is common in older adults, particularly those on long-term diuretic therapy. And like both of them, it is almost never measured in the routine workup for someone presenting with persistent leg swelling. If your doctor is checking thiamine and vitamin C levels, asking about magnesium in the same conversation adds almost nothing to the inconvenience and can close another gap that is quietly contributing to a symptom that no single intervention is fully addressing. Here is the practical framework I want you to take from this video. If you have persistent leg swelling and you are on a diuretic, ask your doctor to check your thiamine level not as a replacement for your current treatment, but as an additional data point that is almost never gathered and can change the picture significantly. If your diet is low in fresh fruit and raw vegetables, vitamin C is worth discussing, again, with a blood level if possible before supplementing. And if your swelling is new, rapidly worsening, or accompanied by any of the symptoms I mentioned earlier, shortness of breath, chest pain, one leg dramatically more swollen than the other, that conversation starts with a same-day evaluation, not a supplement. Margaret's thiamine level was corrected over several weeks, with supplementation under her doctor's supervision. Her diuretic dose was reviewed and adjusted. The swelling that had been creeping upward for 3 years began, slowly, and then more noticeably, to retreat. She told me at a follow-up that she had been so focused on the water pill working that nobody, including herself, had thought to ask what the water pill might be taking away. The most important vitamin for swollen legs and ankles is the one your body is actually missing. Finding out which one that is requires a conversation and a blood test, not a guess at a pharmacy counter. Subscribe. And the next time you or someone you care about is managing swelling that is not fully responding to treatment, you will already know the question worth asking before the next prescription gets written. I'm Dr. Miles. I'll see you in the next one.